As we continue this night and we kind of go through, you'll see up here on the screen, we got a jumper. Up here on the screen, we have the link to follow to go and submit your questions if you haven't already done so. And one of the things that we really wanted to do here at Oasis, and part of the reason that we're here tonight and that we're broadcasting everything, is we know that the last couple years certainly have been difficult. It's revealed a lot of things, and I think really at the end of the day, what has happened is there's a lot of issues that were just kind of festering, and then the pandemic and society and everything else just kind of revealed a whole lot that was actually going on. We know that there's hurt, and we know that there's a lot of struggles that are going on, and what we wanted to do was provide a low-risk environment for people to ask some questions. And just kind of seek some insight, and maybe even get some answers. But even if we don't get the answers, maybe we get a direction that we can go. Throughout the course of the night, there may be a few topics that might, it might provoke some emotions, or whatever the case is. And it is not our desire that we create more chaos or anything of that nature. But we do want to have some discussions as far as what the Lord can do and really even thinking through just different scenarios. We have struggles. We all know that. The Lord knows that. And so tonight, what I want to encourage everyone to do, and even everybody online, is to just listen, to just ask some questions and take on some information. As I go through, I'll have a seat and get myself out of the way, and I'll be facilitating some of the discussion tonight and asking the questions as they come across the internet. But what I would like to do is just invite our panelists, the Fab Four, to introduce yourselves. And so we'll start down here on the end, and if you would, just who you are, a little bit about yourself, practice, etc. So go ahead.
Okay, my name is Brister. I'm an LPC here in Amarillo, Texas, and my wife and I have a private practice together. I've been doing counseling for over 5 years in a variety of settings. Definitely enjoy what I do, the people that I see, and just really excited to be here and hopefully provide some insight to some of the questions you guys might have.
I'm Webb Newton. I'm a licensed professional counselor and a licensed marriage and family therapist here in Texas.
Found you.
And I supervise other therapists as they seek their licensure as well. I have been doing counseling since I got my master's in 1981, which I know is before most people were born. They had to have a senior to come on this board, and so that's why I'm here. I've been married 45 years as well, and so all of that, I think, helps me understand a lot of things. And I practice with the Amarillo Family Institute here in Amarillo.
My name is Melinda Zalman. I'm an LPC associate, so I have my master's degree, and I'm in that training process that Webb was talking about. He is not my supervisor, but I do work at Amarillo Family Institute. I've been married for 4 years to my wonderful husband, and we are new parents to a beautiful baby girl who just turned 5 months old. And I specialize in seeing teenagers and young adults.
Hello, I'm Sherry Medford, and I'm a pediatrician here in Amarillo, Texas, and I practice at Amarillo Children's Clinic. I have been in Amarillo since the year 2000. And so now we call this home because we've been here longer than we have anywhere else. I've been married to my husband for 26 years. His name is Jeff. And we have 2 children. I have a 22-year-old and a 19-year-old. And my 19-year-old has been probably my inspiration of taking care of kids with developmental disabilities. She has Down syndrome. And in my practice, I tend to focus a lot on kids with developmental problems.
Well, we certainly appreciate you guys coming up and volunteering your time to come up here and be a part of this. And I'm just going to jump into some of these questions that have been coming across. Some of you guys have seen them, some of the questions, and feel free to answer at will. And come back and forth and have the discussion even amongst yourselves. So first one that we saw even back there in the back. If the church is supposed to be a safe place for health and healing, then why are the subjects of mental health and addiction still overlooked and looked at as taboo to talk about?
I will be frustrated, so. I mean, yeah, I'll take,
You-
yes, please, make me a play.
I'll start.
Okay.
I was in ministry for 32 years before I decided to go into private practice. Been counseling all through that time, just sort of part-time. I thought we're doing a pretty good job. I realize that in some cultures and in some congregations that is still taboo. The only thing I can think of is it probably comes from the pulpit and the leadership of the congregation as to how much they speak positively about getting counseling, seeking counseling, looking at mental health in a more appropriate way than it's sin, and that something's wrong with that. So I thought we were doing a pretty good job, but I understand it's a struggle for some. Some cultures will also really struggle with that.
So given that, what do you think the taboo, anybody, that causes it to be taboo? Is it West Texas that pull up by your bootstraps and suck it up, or is it, what do you think?
What I see is that sometimes the church feels like mental health, when we say we struggle with that, it's attack on God's sovereignty. Because you hear often, if you pray enough, if you read your Bible, that's what's going to heal you. I've been told that myself. And so if I'm still struggling with it, then what's wrong with me, with my salvation, my relationship with the Lord? And so it's, in kind of what Webb said, it's seen more as a sin. You're not trusting in God. And so from what I've seen, certain people in the church feel as though it's an attack on God and his power, his might, when he can absolutely heal us from our mental health, our physical health issues, but sometimes he chooses not to.
Yeah. It's incredible, actually, just even hearing this is such a positive thing. Just get help. It's available. And I appreciate you speaking into that with just the positive nature of it's okay, right?
And I would say, to end that on an encouraging note, many seminaries, I got my master's at Southwestern Baptist Theological Seminary. You can get your PhD, your PsyD at many of Christian institutes, Fuller Theological Seminary, Biola University in California, DTS, DBU. I mean, there's so many institutes now that have programs for people to get educated on the clinical aspect, but also kind of go along with God's word and God's calling on people too. So.
Okay. Yeah.
And I was just going to add something, looking at it over my 20 years of being a pediatrician, and especially over the last 2 to 3 years with COVID and the pandemic, just have seen it escalate, mental health issues really escalating in my practice, and I'm sure in every primary care practice out there. But I'm surprised a little bit because I really feel like, at least in my world, mental health is starting to become more like just regular disease. I mean, people look at, my son has asthma, my daughter has attention deficit problem, and my other child is bipolar, and her dad's bipolar. I'm just saying, it's like these are true illnesses. It's a disease. It's treated, and I was kind of feeling like we were getting to a point in society right now that it's looked at more like any disease. It's something somebody needs help with. So.
Yeah, I think even our country, if you think about the people who developed this country, we pull up ourselves by our own bootstraps. And that's sustained all through every part of this nation. So it doesn't have to be West Texas. I was raised in West Virginia. I'll guarantee you that it's there. not taking place and that relationship is not feeling fair, that is also confounding the whole relationship. So this ought to be seen probably more than anything as kind of a red flag. Not that they're wanting to come back, but the fact that they had to leave and now come back. What really is going on? There's a whole lot of questions there. And that is really one of the things that's taking place in therapy, is that hopefully all of that comes out. To get it back, you have to rebuild that trust. And that takes time, as well as those other three things that I said.
Yeah, right. I love this. On a personal note, it's pretty awesome up here. So my daughter came home with cuts on her arm. Is this just a phase or a sign of something serious?
I see this quite a bit now in my practice, a lot, especially with teenage girls. But is it serious? Yes, I think it's extremely serious. If you see cuts on your child, and sometimes they do them where they're not going to be as noticeable, like on the inside of their thighs. A lot of times, excuse me, a lot of times they're on the wrist, which you can easily see those usually. But I think it's definitely a sign of something more serious underlying it. It's not in my office a place to totally get into that, but if they're brought in for that, or if I notice it, always bring up the concern. And usually the teenager is very open once you bring it out to tell you really quickly, or at least in my experience, what's going on with them and why they did this and what's happening. Not extensively, but they want help and they want someone to notice and they want someone to help them.
And I'm sorry.
I was going to ask Sherry. Sherry, do you think it's an anxiety reaction or depression?
I think it's depression. And maybe I'm wrong. Maybe I'm wrong. I'm not going to say a lot of these kids are anxious to the point of being so overwhelmed they're depressed.
Right.
But I think that at the point that they're doing this, they're screaming for attention. And I find it very amazing in my office. And it's probably denial because I've been a parent of a teenage child. And you think, oh, if I just don't think about it, it'll go away. But it's amazing to me how many times I'll say something about the child having, what is this? And just saying, what's going on? And the parent's like going, what? What are you talking? Nobody's even noticed. And I think it's a lot of times they're just screaming for someone to notice they're hurting.
And even if it is for attention, give them the attention. You need to give your kids the attention. And then kind of like we were talking about, is it anxiety or depression? Oftentimes those two usually go together. One is usually the cause, like you said, sometimes they get so anxious and overwhelmed that they become depressed. And sometimes you get so depressed, they start being anxious about things. So oftentimes those two go together. One is usually always a primary. And then something else, the question was, is it a phase or is it something more serious? I think two things can be true at the same time. It can be a phase and it can be really serious. Either way, it still needs to be treated well. Like we all go through phases and seasons that are healthy for us and that aren't so healthy for us. And so even if it is a phase, it needs to be navigated through, processed, and dealt with appropriately.
I think any type of self-harm or even threat of self-harm, whether you think they're going to follow through with it, whether the self-harm was even, someone scratching their skin with a pencil, and they're not breaking skin, but the intention is to feel pain, it needs to be addressed as if it's serious. Even if it's a threat that you think your child's not going to follow through, well, why are they making that threat in the first place? Kind of like you said, even if it's for attention, we'll address that and give them that attention. Something deeper is going on, and like you said, even if it's a phase, even if it's just for the next couple of years, it needs to be addressed and dealt with because it is serious, even if just for the next few years.
So get involved.
Yeah, I want to take a sidebar on some of this too. You guys speak to this, but when COVID first hit, I looked at my wife and my colleagues and I said, get ready. We are going to have a tsunami of mental health issues with our young people. The reason being is because anxiety especially is evoked because of the lack of safety. whenever they have lack of safety, they're going to get anxious, and then we got all this other stuff going on. Where do they get this lack of safety? I mean, not only are they getting it from the news and social media, they're looking around and they're seeing masks, they're seeing schools shut down, all the talk that's on, like I said, on the news. They're also getting it from their parents. A lot of parents are so anxious about this. Anxiety is often caught.
Oh, interesting. Yeah,
It
good
is.
statement.
I see how my parents are dealing with this. I'm going to start dealing with it like this. This is how you deal with life. You get anxious. And so they start being anxious. They don't know what to do with it. They don't have the capacity to do anything else. Are you guys seeing that?
Oh, absolutely. And self-harm, there's nothing wrong with pain. It's just self-harm and inflicting pain on yourself, especially in the ways of cutting or hitting, burning, other areas. It's very terminating. So a lot of these kids are anxious. They don't have healthy coping skills. Maybe their parents don't see it. And I don't want to assume that all parents are messing up because their kids are cutting. And some parents are, and I see it, like, we're trying to do everything we can to navigate through this. Like, how can we help them? But a lot of times kids just don't know how to cope with anxiety in a healthy way, so it kind of compounds and it gets bigger. And that's why seeking help is necessary, so that they can cultivate and develop healthy coping skills, because they see someone's cutting and they're like, well, that works for them, so maybe that might work for me too.
Right.
So
let me ask you this all the way across the board then. If you were to give right here, and it says not a diagnosis, I understand if you don't have a patient or somebody that's in your room with you, what would be one coping mechanism, you were talking about this, like coping skill that you could pass on to this parent or a parent when their kid comes home with this, that has anxiety, et cetera? What would be one thing that just start
For cutting
this?
specifically, or anxiety and depression?
Yes. Yeah.
One thing I always tell my teen girls to do is when they have that urge to cut, to write.
To write.
To write. And we talk a lot about pain and truth in our office. And so when we get to the pain and the reason that they're cutting, I'll have them write the truth instead.
Yeah.
What's true about you? You know, the pain is, I'm not good enough. Okay, but what's the truth? You're forgiven. You are enough, whatever that is for them. Instead of cutting, writing that on themselves in that place where they're scarred. Because a lot of these kids do have scars there, so that they're reminded of that truth, and then they're trading the pain for the truth.
Interesting, right. It's proactive, yeah.
And you also want to meet people where they're at too. Journaling is an awesome coping mechanism. So is painting, so is exercising, so is grabbing coffee with a friend. If I do have someone on the couch across from me, I just kind of want to gauge at like what coping mechanism is going to work best for them and who they are as a person. So if I tell somebody that hates reading to read 3 books, that might not help, but it might help for somebody else. So just kind of getting an idea of someone's personality and what they've done in the past that has helped, and getting them to bring that out. So
Okay. Right. So next question. Let's see. How can I help my daughter learn to cope better with test anxiety? She knows we don't expect A's, but she is a perfectionist and expects it from herself. So I guess it's a coping mechanism here. But
What I do with teens, again, is for the parent to be able to help them cope, the parent has to know how to cope too. And with small children especially, I talk about co-regulation with the parent, where if the parent is doing deep breathing and remaining calm and modeling that for their kid, kind of like we talked about, if the parent is being anxious, the child's going to be anxious. And you see that when a child has a tantrum and the parent gets emotionally elevated and the child is too, and they go back and forth. So if the parent can regulate with them, if the parent can learn coping skills with them, that would be my first suggestion.
And oftentimes anxiety is a learned behavior. A lot of times what we've seen, Lynn Lyons, she's an expert on anxiety, so if anybody out there has any questions about anxiety in kids, she's the person to go to. But a lot of times I'll ask teens, where do you think you learned your anxiety from? And is there anyone else that has anxiety? And if you really think about it, it could be a parent or it could be another relative. So it's not necessarily genetic, but more kind of learned what they see. And so, and a lot of times with this test anxiety too, I wouldn't really even focus so much on the testing or the coping skill, but identifying cognitive distortions. What lens are what lens are you filtering the situation through? And so what I do a lot of times in counseling is we identify cognitive distortions and their lens in which we filter the world and events through that are negative.
Jump on top of that, to add to that, especially in test anxiety, what would you say it would mean if you got a B? What would you say that it meant if you failed this test? Understanding what those negative cognitions that they're struggling with, and then as a parent, help challenge those. You know, we tell our kids all the time, we just want you to do the best you can. Well, I don't know about you, but that means I got to do an A. Because apparently that's the best I'm supposed to do. But to challenge those negative cognitions with them, and also help them do some relaxation, some breathing, because there's some very mindfulness stuff that could take place that could help them.
And I would even say be careful with using the phrase with your kids, and this applies to me too. Do the best you can. That phrase can be very anxiety provoking. Like, what is the best I can do? Am I doing my best? Why am I not doing my best? It can really send kids and individuals down a rabbit hole or start spiraling. So just be careful about the language you use when talking with your kids or loved ones that might be struggling with anxiety.
Perfectionism is a coping, usually because of a safety issue. And what I mean safety issue is, like I said before, if I'm not perfect, what is that saying about me? Or what am I afraid is going to happen? And that's when it becomes a safety issue.
Gotcha. That's strong. So, next question. My husband seems more easily irritated and tends to overreact to situations the last few years, especially for our family. He often doesn't recognize it occurring and discounts it if I say anything. It's difficult to experience the harshness with us and see him treat others with more kindness. How can I help diffuse his reactions? First question. And should I look into marriage or family counseling to help our home have less conflict?
Anger is a secondary emotion, and men, this tends to, we see a lot of men struggle with this. This is something I struggle with, like catching myself being a little too irritated or just grouchy, you know, that stereotypical grouchy dad. But a lot of times it's because men have a really hard time modulating and identifying their emotions. And so if a man is increasingly becoming angry and irritable, there's other emotions underneath that need to be dealt with and processed. And so men just we're just not wired to really naturally verbalize or vocalize our feelings and emotions. It takes a lot more work for us to do that, and that's why, but it's still important nonetheless.
Hang on, I'm thinking.
Okay.
Got to give me time to think. The question again was, what can I do to help regulate him?
Yes, how can I help diffuse his reactions?
Right.
And then should I look into marriage or family counseling to help our home have pretty much that comment?
Well, I mean, I've got to stay in business, so the answer is yes. And realistically, I mean, we're there for a reason. It really does help. And everything Anthony says is true. There is, if in the idea that it's a secondary emotion, or the primary, secondary emotions are often we consider as just reactions. Depression, anxiety, anger, those type of things. We often say, I'm feeling depressed. Well, actually what's happening is we are acting depressed. We are doing depression because something's underneath that. And so what is really helpful, possibly, depending on the relationship of the wife, is whether or not she can actually help him process those emotions or not. And don't look at anger as the emotion. Like Anthony said perfectly, there's something underneath there. It could be fear of failure, like we had just got talked about. I'm not enough. I'm inadequate. There could be a number of things. And then realize he's either going to diffuse himself or not. You can't diffuse the situation without cooperation from the other person. So you just don't want to play into it and create more chaos by trying to control your spouse. But there's so much benefit of just being kind and considerate. Help me understand what's going on with you, husband. I would really like to know, would you please open up to me? And a lot of times you just got to give them space too. And at least they know that you're aware of it and concerned and willing to talk if they are.
And I would say men experience depression and anger a little bit differently at times. There's this good book called I Don't Want to Talk About It. There's very few literature or any research on depression in men, so it's one of the very few books that kind of expands on depression in men. The author uses two key elements to define depression in men, and covert and overt depression. Men tend to engage in covert depression. They have it. They don't have healthy ways of coping. They might go golfing. They might do a lot of drinking. They might engage in hypersexual activity, work. Men that are struggling with depression or anger issues oftentimes have certain ways to cope that aren't necessarily healthy, but distract them from what is actually happening mentally.
So kind of going into one of these questions, apparently there's a lot of questions that have been coming in that are kind of in this vein, but and it's grief and loss, and it's going to be maybe even a theological question here is, why does God have to take away everyone that we love? Welcome to 2020.
Where's Bradley?
Right.
Can he not answer that?
Yeah.
I'm going to say one thing about that, and that is, I don't know how to say this one. It's going to sound almost harsh. Instead of asking why, I think the bigger question is why not? I think we look at this world as something that's supposed to be nice and easy and pleasant. And the truth is, we live in a fallen world where death and pain are going to take place. And so to ask why, I really think sometimes it's the wrong question. I really do think it is, of course it's going to happen. Yeah. Why not? Look where we live.
Right. It's just, it hits on a different level because it's so close to you.
Oh, sure.
Sure.
And loss is, and grief is so messy, and it's so painful, and it hurts so deeply that, and if you try to make sense out of it, it just won't work. How can you make sense out of loss like that?
Right.
And everybody grieves in their own way. There's no textbook way how to grieve. And I've seen people come in that kind of want this simple step-by-step process how to grieve, and there just really isn't. But the one thing I would say is allow yourself to grieve. Allow yourself to process the emotions and thoughts that you have associated with your grief. You don't get over the loss of someone, you go through it.
So in that, with, I guess the grief, we're such a, I think it's, as a creation, we love our checklists, and everything needs to be in its place. I think that's such an important thing that you just said with just grieve. It's important to grieve, and to, I guess, just go through that process.
In my world, I deal more with mothers and fathers who've lost their children, and I can't imagine that grief. It's just not the where it's supposed to go. And I'm not talking about immediate grief, but I'm talking about long-standing, maybe a year, 2 years after. A lot of my mothers and fathers have really, it's really helped them to go walk along beside somebody who is experiencing what they experienced when it is acute in that person, if that makes any sense. And it seems to heal the parent that's walking along beside them, and it's obviously really comforting for the people that are there as much as it can be. It's always nice to have someone beside you that's gone through what you've gone through. I mean, it's a horrible thing, and I think that it's comforting for both of them. And I've just seen some families that have really been amazing in that role and have really been healed or healing over time because they are walking it with other people.
Yeah, I like to emphasize that because we are not meant to live in a vacuum. We're not meant to live in a cave all by ourselves. We are meant to be with people, and especially during times of grief. They will have the ability to let them know, especially around this question, that there are people that are still around her that they love, that love her or love him, and that they're not alone. That is a huge message. Right. You are not alone.
Right, yeah. The Creator favors community.
And he gives us, he gives us trials, and we get to use what we learn in our trials to go help people with similar trials. Yeah.
And kind of add to some of what you've said, what you all have said. When you're dealing with families that have lost the same person or a couple, keeping in mind that everybody grieves differently. What I've seen is that, the couple, they're mad at each other because the wife is crying and she's expressing outwardly what she's feeling. The husband is quiet and he's dealing with his grief internally. And she's mad at him for not talking to her, and he's mad at her for always wanting to talk, and just realizing that everybody deals with grief differently. Even if you're grieving the same person, your child is going to deal with it differently. Everyone does. And so respecting that and leaning into each other. So allowing your spouse or someone else the space to talk if they need to, and then allowing someone the space to you sit silently with them if that's what they need.
So maybe even slightly in this vein, or it will touch it, it's dealing with own depression. And it says, it's easy to see others' depression and not see your own because you're afraid to admit you're sick. How do you let your loved ones know without fear of rejection?
Let your loved ones know that you're depressed or that you think they might be depressed.
That you are. Yeah, so I think it's dealing with their own depression.
I would say it's okay to be scared. It's okay to be afraid. But the one thing that you have to also keep in mind is depression wants you to be isolated. Depression doesn't want you to connect with your family or be open. It wants to kind of keep you closed off. So kind of having that in perspective too.
I think you would want to tell your family, despite the fear of rejection. Do not let rejection paralyze you from doing what you need to do to take care of yourself.
And if you're rejected by your family, that says a lot more about them than it does you. So don't accept their rejection. Deny that rejection, because you are confessing or speaking out what is going on with you in hopes that it will improve your relationship with them or improve your depression. So you want to be careful of engaging in fear-based decision-making. I don't want to talk about my depression because I'm afraid of what will happen. So, and I use this a lot in therapy, is like, be careful of fear-based decision-making, be careful of fear-based motivation, because that is a very dangerous, that's a very dangerous place to be in.
So, on this, do you see, have you guys, any of you, have you seen more of that, just I don't know if it's a denial of their own depression, or I would think that in the last couple of years, the depression, in fact, you spoke of it of get ready, that flood is coming. So are you seeing more of that, even of where you kind of got to work through, the individuals are having to work through like, their own depression, and I don't even know exactly what I'm asking with this. In my mind, I'm seeing it with students, even in our student ministry, where they're identifying it with tons of people, but it's, you're pointing out your symptoms.
And some people don't even realize that they're anxious or depressed. So I did a similar thing at Redeemer Church, and I used these forms. It's called a PHQ-9 and a GAD-7, so I'm familiar with it. And so I kind of had everyone fill it out. And so I'm like, look, these are what high scores are. These are what, and they were just shocked how high their scores were. Like, wow, I scored really high on the GAD-7. I scored really high on the PHQ-9, and they just had no clue that they might even be struggling with something clinical.
Oh, gotcha.
What I've seen most is a rise in anxiety, more so, or at least that's what they're identifying. And because I'm dealing with teenagers and a lot of children too, with parents, is you have to realize for a kid, their sense of safety in the past 2 years is shot. Like, mommy and daddy are the person that protect me, and they can't protect me from this. And unlike a lot of other things that we've experienced in our world, this, like Webb said, this is not something that you can protect them from seeing. It's in the news, it's at school. For at least 6 months, their entire social life was gone. Their routine was shot. And if you know anything about kids and teens, routine is important. Safety is predictability. If they don't know what's going to happen, they're scared. And if mommy and daddy, the people that are in charge of taking care of me, can't protect me, then what do I do? And so I've seen a lot more of anxiety in teens and children, because, they are very aware at an early age that they don't feel safe.
So in the safety, when to act, this is, somebody asked this question. If someone tells us that they're talking about running away or hurting themselves, what do you think is the best for me to do with that information? So I'm assuming this may be a teenager.
Tell their parents. And I've had teenagers be like, what if I lose? I don't care if you're afraid of losing that friendship. You are going to potentially lose that friend regardless, so wouldn't you rather them be alive or safe?
So it's all in, yeah.
And it's scary, but like you said, don't make a fear decision. If your friend tells you, I'm going to hurt myself, number one, they're asking for help. Number two, the parent is there.
I would say if they have a plan, that's pretty textbook. You're going to hurt yourself. Do you have a plan? How would you do it? When would you do it? If the more detailed they are in that, the more at risk they are of following through with it. So respectfully ask questions, but if they're a teenager, you definitely want to inform their parents, and that's what a good friend would do. You want to do the best for your friend, even though they might get angry with you.
Right. Counseling options. What counseling options are available for someone on a fixed or limited income?
And we have patients a lot of times, I do, that maybe self-pay or don't have insurance or money to pay for counseling. And I'm not saying it's a perfect system, but there is something called Texas Panhandle Centers, and they are available for people for free of charge. Also, there's a clinic here in Amarillo. It's called Heal the City, and that through that free clinic, they also have TPC counselors there, and they have pastors there, and they have LPCs that come and volunteer their time, and they also have free medications for all people that need medication for their mental illness as well. So those are the two options I know of.
Yeah, those are great. The other thing is, especially if they're tied, if this person that is needing the therapy or counseling is in a church. A lot of churches are helping out. They'll provide several sessions, if not all, that's needed to care. But that goes back to our, what was that, the first question, as far as whether there was a stigma of mental health. But usually the leadership is more than willing to step in and help with the finances with that.
Yeah, I've seen that a lot. Several churches, even here in Amarillo, will pay your session fees. And so family support service is another great one. Local universities, not just in Amarillo, we have WTA, but we also have Texas Tech Health Science Center. And so a lot of times they have reasonably priced care that you can reach out for.
One of the things that is the benefit, especially at AFI or anybody else that has associates, and these are people that have come out of school, they have all the knowledge, now they're getting a lot of practice, and they have to have so many hours in order to do that. They usually work off a greatly reduced fee. And so I know at AFI we have at least greatly reduced fee. We have, what, 3, 4? Yeah, 3.
4 because of Jill.
Oh, yeah, 4. So, and other places will do the same.
Yes, your LPC associates will take greatly reduced fees, and they're not completely incompetent.
Good to know. I don't know what this is, so totally I trust you anyway. EMDR therapy, does it work, and who are the people who are most helped by it?
I don't do EMDR. I'm very familiar with it. From my knowledge, it works really well with victims of trauma, people that are really having a hard time navigating through a traumatic experience. And research shows that it does work.
So, what is it?
I do it.
Okay.
It's called eye movement desensitization reprocessing. And the person who developed it said they wish they just called it reprocessing because that's too long of a word. It uses bilateral stimulation, which means you're through eye movement or through, I use vibration because it's too hard on my arm to do eye movement all the time. But it helps a person take a memory or a situation and help their brain process it in a very calming way. In fact, bilateral stimulation is a strategy in helping anxiety in the moment, where you're doing a butterfly tap or touching your, with both hands, touching your hips or your knees, taking a ball and throwing it back and forth between your hands. That's just bilateral stimulation. I've used it for returning vets who have been through horrific situations. I've used it for rape victims, assault victims. I've used it for first responders who have seen horrific things as well. And what's amazing, it can take a situation that on a disturbance level is from 0 to 10 is a 10, and with a couple sessions can drop it all the way down to a 0, so they can still recall the situation but not be as disturbed by the memory.
Wow.
So it is amazing. Every time I do it, I'm just overwhelmed with not only their response after they get through with it, but just see how it works. We really don't know how it's working. We do know that it works.
Wow.
And it is not hypnosis. That's usually the pushback in my office when I suggest it. It's like, well, that's hypnosis, and that won't work on me. It's not hypnosis, so I just want everybody to know that.
Wow. So, suicidal thoughts. I feel like a hypocritical Christian for still struggling with suicidal thoughts. I've come a very long way, but sometimes I feel too ashamed to go to God when the night before I didn't want to wake up. How do you fight this?
I would pose a question, and that is, would you say that David is a man after God's own heart, as Scripture says? I think all of us would, because it's in Scripture. David comes to God when he feels that way. And if you disagree with me, I would urge you to read Psalms, because there are some very low Psalms that David wrote, and Solomon does too in Ecclesiastes. And they they turn to God in those moments too. And so my urge would be to even read that scripture where you can relate to David in that moment. And if you're ready, turn to God as he did.
But and everybody has suicidal thoughts to certain degrees, even if it's in kidding, even if it's extremely serious. Like everybody struggles with suicidal thoughts to some degree. Yes, the suicidal thoughts are concerning, but the shame that's associated with the suicidal thought is what is exacerbating the issue. It's like I'm having these suicidal thoughts, therefore I am ashamed. So I'm gonna hide from God. When in reality, I'm struggling with this. I need to turn to God.
And the shame actually increases or exacerbates the shame. Shame. I shouldn't be doing this. As a Christian, I shouldn't be feeling this. Now I'm really beating myself up, and so it's a terrible cycle.
Wow. Yeah. I didn't even think about that as the shame pushing it. It kind of is a force multiplier. It just takes it to another level. And gosh, we do that in so many ways. If I shouldn't do this, and how many people no longer go to church because they missed a handful of days, and so now I don't go back because of the shame, and then it turns into years.
You
right?
become enslaved to your shame.
Yeah.
In your shame, guilt, those can be very enslaving, and so that's why that's important to turn towards God, because give me your shame, give me your guilt. I'll take this. I will carry this for you. And that's the enemy trying to drive a wedge between you and Christ.
In one of my favorite books, The Soul of Shame by Dr. Kurt Thompson, he talks about how shame's goal is to isolate us. No one's going to care about you. No one's going to love you. These people are going to reject you. God's going to reject you. And so you're isolated, you're alone. And actually the way of healing shame is coming out of that and talking about it, talking to God, because we know in this moment, maybe not in that moment, that he's still going to love us. He's still going to accept us. And there are actually other people in their lives that probably will too. And that's when we heal. Whenever I can't tell this secret because no one's going to be able to look at me the same, and then I tell my husband and he looks at me with the same love that he did yesterday, that can help heal that shame.
Mm-hmm.
So I think a larger discussion about shame is really important, because we look at everything that shame debilitates. I think of addictions. I may have a particular issue in life, and I think that I can go ahead and it's causing me pain, some kind of emotional pain, whatever. And so I think I'm going to use, and so I go ahead and use, and then there's some pleasure or relief that comes after I use, and then there are some consequences possibly, and then ultimately at the very bottom of that little ladder going downwards, there is shame, because I just did this, which drives it right back up to the very top of the cycle, and there I go again. So shame is a huge debilitator. It's something we really need to be aware of in our mental health.
And shame reinforces labels. Shame reinforces I am not good enough. Because I am not good enough, therefore I am this. And labels are terminating. When you engage in labels, it limits your way out. Like I should not think this way. Because I think this way, I am not good enough. Therefore, I'll never be. I can't get out of this. So it's just reinforcing the self-concept that is debilitating.
Wow.
Well, and something to keep in mind is shame is not always I'm worthless. Sometimes our responses to shame, I'm going to be perfect. That way I don't have to feel shame. It's being prideful. I'm not willing to admit I'm wrong because that makes me feel ashamed. And so these higher feelings of perfectionism or pride or arrogance even are also shame-based.
That's incredible. Even hearing you guys talk about the nature of depression being isolating, shame being isolating. So I definitely see where those things, they just push each other farther along. So you go deeper into whatever, the depression or that's
Yeah.
incredible.
Yeah, I think at least the people on this stage here will do, especially if they're talking. And I would encourage, if you have a friend that is shame-based, continually pouring shame onto themselves, that as we do in our offices, we don't just listen.
Mm.
We challenge. Challenge in the fact that, okay, you feel worthless. Is that true? You really believe that you are nothing but a piece of scum? And then as friends, I'm going to challenge that. Because we get truth in three ways. Sometimes we innately know truth. I know I'm not worthless. Sometimes it is through significant people in our life who come around us and encourage us what's really true. And sometimes it is our spiritual resources. If I have Jesus sitting right beside me and he says, yeah, you're worthless. Really? Would Jesus say that? For God so loved the world that he gave his only begotten son to everybody but you? No. So a good friend or a good counselor is not going to, they're going to do more than just listen. They're going to challenge.
And I know we're kind of going down like a
No,
rabbit,
go though.
but I would also, I think he made a good point. Like we don't just listen, we challenge. There's accountability. There's a friendship element. There is an educator element to counseling. So counseling is not about telling you nice things, telling you things that you want to hear necessarily. It's not just talking about your emotions and feelings, but it's an opportunity for your brain for you to become self-aware, and for you to challenge those irrational beliefs and thoughts that you have about self and other people.
So, as a parent of two teenagers, we have to tell them the truth. Sometimes we have to get in their business. Maybe some insight into that. Maybe a tips or tricks for us as parents to talk to our kids about anything. You know, like we're going to speak some truth into them. We're going to do this with whatever they're struggling with. And so we look at them, and not only are we going to listen, but we're going to tell them, that's just not going to work. That's not who you are. Maybe a tip or trick, whatever that you would recommend.
Well, a lot of kids ask why. So
Yeah.
that serves a perfect opportunity to be like, well, like this is why. And I know a lot of parents get frustrated and they feel challenged a lot of the times when their kids ask why, because I said so. Well, that doesn't help them grow. That doesn't help them get perspective. So that's a perfect opportunity for you to kind of explain and kind of walk them through that problem-solving process.
Okay.
Something to keep in mind is that, and we forget this about children and teens, their minds aren't completely developed.
Sure.
So we expect them to act and understand like an adult when they mentally aren't capable of that. So what I always challenge parents with is, because if you don't remember being a teenager, I would want to know why. But everybody does. We all remember being a teenager, being a child, and going from that perspective, not of, oh, I wish someone had told me this, or this is what somebody should have done. No. How would I have felt as a 16-year-old, as a 15-year-old, if my parents came and had this conversation with me? And what would I have needed from them in that moment? And then doing that, whatever you would have needed as a kid, as a teen, be that parent that you wanted.
Interesting.
Sherry, you raised kids. How'd you do all of that?
My children are a little bit different. I have the 19-year-old's the easy one because she's exempt from all the things that you all are talking about. There is no anxiety, depression, or worry about what's going on social media. My 22-year-old was the 180, so that was a totally different story. Plus, she had the shame and guilt of having a sister who had a disability. So she went through a lot of counseling actually during her middle school years because of that. And I felt at that time, I felt like I had to get some professional help just because of where she was. But the majority of the time, she she and I have been able to work through a lot of her anxiety and her just questioning different things. But I think that people also need to understand, so I'm not really answering your question, but this is what I will say. There's a point where a parent can sit down and talk to a child and speak truth into that child. There's also a point where every time I speak to my 15-year-old, who's now 22, it is like she hears her fingernails going down the chalkboard, and she cannot hear a thing I'm saying to her because she does not, she just doesn't want to listen to what I have to say. And at that point, it's not helping. We're not helping each other. And there is a point where I think sometimes you do need to go get somebody like one of these lovely people up here for your child to go talk to, because in that instance, my daughter didn't want to talk to me. She was ashamed that she was ashamed of her sister. And so, and she's not now, and she loves her to death, but it's just that middle school, you know, you're trying to learn who you are and what you are, and then you have this, you know, this abnormal child in your home. So she didn't want to talk to me about that because she felt bad about that. So that's when you remove it and you go get some real help.
Daniel Siegel is somebody who I really admire, who is all about neuroscience, and he wrote a book called The Whole Brain Child, or No Drama Discipline. And one of the things that he really encourages for parents to do is first to connect with the emotion before you go to the logic. It's almost as if they can't get to the logic until you first connect with the emotion. I have found that to be extremely beneficial. I have 2 boys, and they are now adults. One is, 38. The other one's 32, 33. And I'll tell you that both of those occasions, it was terrible teenage years. Terrible, terrible. And so one of the things, while I would speak truth to them, and I would tell them some things, I don't think I really connected very well with their emotions. And I think I could have done a lot better job. But having said that, knowing that I wasn't the perfect parent, which, by the way, to all of those people out there that are striving to be the perfect parent, I want you to go ahead and do that. We will still see them in therapy. We will. Mainly because you're not the only influences in their life. And you are especially an influence, and that's why we're seeing them in therapy. No, but the teenage years is not the final chapter in the book.
Right on.
And one of the blessings that I have seen is that my boys have come back to me and said, "Dad, you remember when?" And they would tell me all the things that I said that they would totally ignore, and now they are really embracing how true those were. And so that's something that parents that are in the midst of it can really, I think, lean on.
And I want to speak to the parents of teens and children. Do not, and you may feel it, but please don't feel shame if you do bring your child to us, if you do bring your child to a counselor. I don't look at the parents of my kids and teenagers and think, wow, they must have really screwed up if this person's in my office. No, I'm sitting there thinking, wow, they really love their kid that they're willing to do this for them. And that goes for even couples or anybody. Don't feel shame with it. Now, there may be times where I make suggestions, the counselor may make suggestions on things you could do differently, because if no one taught, I tell my clients, no one taught you how to cope. So if you don't know how to cope, you don't know how to teach your child how to cope, well, then we can teach you how to do that. And so there may be suggestions that we make that may be changing some things that you do, but don't, I like what you said, don't let it be a fear-based decision. I'm not going to take my kid to this because what is that person going to think of me? Do what's best for your child.
All right. Man, that's incredible. So what we're going to do right now, a lot of everybody has sat here for an hour, and so let's take a 10-minute break and get a breather. You guys go get something to drink or go to the restroom or something. We'll be back in here. Actually, let's do it for 7 minutes. So 7:10, and then we have a handful of questions left, and then we'll wrap up here shortly. So small little break here.